I think e-health is really moving from a previously totally paper-based system to hopefully a totally electronic system with increased communication, increased efficiencies and increased effective delivery of healthcare system within the system that we work in.
It's basically a means of transferring information electronically between healthcare providers and patients to improve patient care and to lower costs.
E-health is another tool which helps health professionals manage the care of the patients that they look after much more effectively and much more efficiently.
As our society continues to live longer, adopt a more adverse lifestyle and faces the increase of chronic diseases, our healthcare system as we know it is buckling under the pressure and faces escalating costs. As a result, a new generation in healthcare focuses not only on the building of wellness, but also provides tools that allows more informed choices and encourages a more active role in the maintenance of personal health.
Everyone will be in control of their electronic health record. They will be able to control if they have one, and they'll be able to control who can access it and when they can access it. People will be in control.
It's really important that we're giving our customers the correct medication. We need to know if there are any contraindications between medications. But if I had a record I could refer to, then I'd know with some certainty that I'm dispensing the right medicine for the right person. It'd be really useful.
There's a really good vibe. Nehta hosted a breakfast this morning. We had about 60 people. We had a good speech by Brendan Lovelock, head of HISA, plus Stuart Smith, who's doing some excellent work in games in health.
This podcast was produced by the National E-Health Transition Authority, Nehta, for the Australian Government. Healthcare services in Australia are world-class, but growing demand means that significant efficiency improvements are needed to take us into the future. A number of these changes will be achieved by electronic health, or e-health.
What we're going to cover is some of the aspects of use of SNOMED clinical terms for clinicians and other users who want to know a little bit more about SNOMED without going into a lot of the technical details.
Well, ideally it means that you can start to collect data at a macro level and you can start to analyse what's happening in terms of trends and health outcomes. Hopefully it leads to better outcomes, quality improvements, lower costs to the system.
Well, as I mentioned before, it's around better sharing of information.
It's improved quality and safety for all Australians, essentially.
Oh, it's fabulous. Everyone's very interested in e-health. It's great to see. So, yeah, we're really enjoying it.
Well, I think it's a fascinating event to recognising the importance of the consumer in healthcare.
Transmitted, so one provider can log into referrals.
The idea of going into a social space, a collaborative space.
I think people are very interested in the fact that it's taking place, that we're looking at what the consumer wants and what we can use, how we can use technology to deliver to the health consumer.
The fusion of modern technology and traditional healthcare will see the emergence of new opportunities to empower the care and wellness of Australians into the future.
It's easy because when I see a patient, I've got access to all the bits of information. When they've been in the hospital system and I'm in general practice, I can see what drugs they've had and what their diagnosis are. When I'm in the hospital system, the same things about what they've had in general practice. No longer a patient struggling to remember what drug they were allergic to 10 years ago. It's all available to me when we need it.
I think patients with chronic disease appropriately receive team-based care from a number of individuals, and to have them all with some information or consistency about what's been happening to that patient, where they're at, what tablets they're taking, what medications they're on, improves the care that each of the members of the team offers and enables us to work much more effectively so that resources can be used where they're needed instead of wasted or misdirected as they often are without proper communication.
With good e-health, it means GPs and other specialists can manage their patients' care much more accurately with up-to-date information that's easily accessible.
E-health is really going to put power into the hands of the individual. That's what e-health is all about, putting us in charge of our own health. It's making the health system more effective for all Australians.
It won't be too long before e-health is up and running and available to everyone. In the very near future, we'll be able to embrace this new electronic system and see the emergence of an even stronger health service for every Australian.